officers.
Good afternoon, everybody, and welcome back to this week's Zoom session. Today, we're going to be doing ENT shred, and we have Sergeant Dominguez and a few guests from Keesler Air Force Base. Sergeant Dominguez, go ahead and start whenever you are ready. Make sure to unmute your microphone, though.
All right. Thank you, Sergeant Kaloides. Yes, so my name is Tech Sergeant Dominguez. I have Master Sergeant Mickens, who is an ENT tech, and Lieutenant Amazon, who was a previous ENT tech here joining me today. Like Sergeant Kaloides said, I'm at Keesler Air Force Base. I've been here for 7.5 years. 3 of those years have been in ENT. Basically, I just wanted to give you guys some information as far as what our job offers, things you can do outside of this career, and kind of give you guys some fun facts about ENT. So ENT is stands for ear, nose, and throat. Our career is also called Otolaryngology. It's typically a lot harder to say than ENT. People tend to have a common misconception about ENT. Everybody thinks it's just boogers and earwax, and it's not. We have a lot of different subspecialties within our service. We do anything with neuro-otology, which focuses on diseases with the ears and balancing system. We also focus on rhinology, which deals with nose surgeries and sinus surgeries. We deal with sleep problems, such as snoring or having difficulty with obstruction as far as with the mouth. We do pediatric surgeries, and that ranges from ears, nose, and throat as far as swallowing and stuff. We deal with head and neck surgeries. We do a lot of cancer surgeries and thyroid surgeries. We deal with a lot of laryngology services as far as vocal cords, laryngeal cancer. We deal with facial plastics, so cosmetic stuff, facial reconstruction, cancer reconstruction. And so there's a lot of that ENT offers as far as our service. It's not just noses and ears. We offer a lot of different services. As far as Keesler goes, we happen to have different services we provide specifically. I know a lot of clinics out there have a specific ear cleaning day, so we offer that as well. We are fortunate enough to have 2 great doctors here, and one of them happens to be a head and neck reconstruction doctor, so we deal with a lot of cancer cases here. We support the majority of the Gulf Coast, so that includes Louisiana, Mississippi, Alabama, and parts of Florida. Our typical hours tend to be 7:30 to 4:30. If we have a surgery that runs a little bit longer, then we stay, we stay to help out, but we don't ever really pull call. Like I mentioned, we currently have 2 providers, and they each have their own clinic days and their own surgical days. And as far as clinical days, we the normal day-to-day routine is, preparing the paperwork the day before, and then, the day of, we're taking vitals of our patients, we're rooming our patients, we clean the room afterwards. A lot of people seem to think that that's all we do, but we end up having to handle a lot of different other aspects that isn't even related to our job, as far as managing our equipment, managing our supplies, creating different fin plans. For budgeting our supplies, we also tend to be in charge of contractors or civilians that work with us. Other things that we do in the clinic is we assist in minor procedures like tonsil abscesses, ear tubes, mostly for adults because kids tend to not stay still, and skin excisions. We also do dressing changes, drain, staple, suture, splint removals. And like I mentioned, we have a day where we, as the techs, do a special clinic day for just removing cerumen. For surgical days, we normally go and ensure that all our cases are ready for the day, and we assist the providers. Getting to assist the providers makes the cases go a lot smoother because you tend to learn what specifically that doctor uses or how each one does surgery in their own unique way. I ended up liking ENT because when I went to my phase 2, the majority of my cases that I was put into were ENT. And even though they weren't extensive cases in that specific base, I liked the aspect of how much internally and externally a person's face can change. You do the nose job and it can be because of a deviated septum, so a crooked nose, or it can be just a cosmetic change, and it makes a drastic change on the person's face. I have 2 really great docs that I work with, and even when I was in San Antonio, I've always felt like, as far as ENT providers go, they're always really down to earth, and we tend to have a saying that ENT has kind of been like their own little world because we just tend to all get along pretty well. So as far as likes and dislikes, luckily I got to have a little bit of exposure to the clinic before I even joined ENT, which was an eye opener because you're used to having only patients asleep during surgery as a 4-in-1 slick. And in the clinic, as an ENT tech, you kind of get to build a rapport with your patients. You get to know them before surgery, during surgery, after surgery. You kind of see how their experience as far as clinical and surgical you kind of see that process of how it goes. So you get to see certain transformations. As far as dislikes go, there's not really that many. Like I said, we all tend to get along pretty good. We all have fun with what we're doing. I know a lot of people, and like the other shreds I mentioned, have talked about promotion eligibility. But honestly, I happen to be fortunate enough to make rank pretty quickly, even as an ENT tech. My partner here, Lieutenant Amazon, also made rank. He made Master Sergeant his first time. Master Sergeant Makins also made rank pretty quickly. So it is a little bit more difficult because it's a smaller pool, but at the same time, I think it's just, it's the same all throughout the military. It's just smaller pool in the shreds. And then the other thing that I can mention about ENT as far as the dislike would be that we don't really have that many options as far as locations to go. Stateside, we have about 7 or 8 different locations we can go. But overseas, we only really have like 4. So I would say like that would be the only kind of thing about it, is we don't really have a lot of options to kind of spread out a little bit more and offer our services. Some of the things you can do with the experience that you get from being an ENT tech is, you always have the option of going the first assist route, where you can pretty much support the providers, whether it's, you get that kind of surgical experience from scrubbing with the providers during your military career, and then once you're outside, you take that experience with you and you kind of apply it more in a first assist position. But since ENT, whether you're pipeline or you're a prior service tech, since you're constantly having exposure to the other services for keeping up with your skills, that, you can always get out of the military, whether you're an ENT tech or a SLIC, and still have the knowledge of scrubbing surgical cases with other services. You can also get a lot of job offers from the providers you work with. They tend to kind of already build a rapport with you while you're working with them. And so they get comfortable with you. They know that you're very skilled. And so you tend to get job offers from them as well. As far as applying for the ENT position, it's similar to the other services. So as far as first-term airmen, applying the requirements tends to be not earlier than the first duty day of the month during which they complete 35 months of their current enlistment, or if you're a 6-year enlistee, then it's 59 months, sorry. And not later than the last duty day of the 43rd month of their current enlistment, or 67 months for 6 years. For prior service members or second term or career airmen, it's a little different routes. They have a thing in MyPERS where they have opt out and opt in, and basically the opt out portion is seeing how many in your specific AFSC are required to retrain out. So that kind of gives you a chance to see, okay, like in my AFSC, I know that they need people to, to retrain in a different AFSC, so I have the option of trying to apply for a different AFSC. This, and like I said, this affects more the second term airmen or the career airmen. And the opt-in portion shows how many that AFSC will need of those members. And I would just, that's something you can always look in MyPERS and just, it's not always accurate, but at least it'll give you an idea of how many they're looking to get out of a certain AFSC and how many they're looking to accept for AFSC. As far as the application process is similar to the other shreds. If you've been listening, you have to complete a 422. You have the SRB statement of understanding, which deals with the bonuses, which currently right now the bonuses for ENT have started to dwindle away. We currently have only one zone, which tends to be if I'm not mistaken, the 10 to 14 range. They have currently a multiplier of 1. But so you have to fill out a understanding saying, whether you are entitled to the bonus or not because of the fact that they don't have it at that moment. The course is 10 to 11 weeks long. It's divided into a didactic portion and then a clinical and surgical portion. The didactic portion is hosted at Wilford Hall, and the clinical and surgical is kind of a combination of Wilford Hall and SAMC. And the class size right now is currently 2 techs. So it's usually 1 per instructor. And they're only accepting prior service members. I know that they're looking into trying to get more pipeline students added, but that's all in the works right now. And then typically there's 3 classes per fiscal year that they're taking right now. And then the only thing I would like to add to that is that sometimes the communication between AFPC and the application process is kind of slow. So then that's where you have to kind of find how to communicate with your leadership so that they can communicate with the CFM or a career functional manager to help provide the assistance of trying to speed things along. The instructors, unfortunately, do not have the access to really help as far as their end. But that's why they recommend trying to get involved with the CFM and trying to help the process along. I did speak with one of the instructors, and one of the things that they recommend is, since it's such a long course, is trying to get either having your own personal vehicle there with you, or trying to get the approval of having authorized a rental car. That way it makes transportation a lot easier. Do you have anything you would like to add? Okay, well, if that's it, I'm gonna go ahead and go to some questions. So I have, do we work a lot with plastic providers, or do your doctors do all facial plastics? For example, facelifts, rhinoplasty, brow lifts. So it just depends. The location that you go to, it just depends on what your provider is certified in. Like I mentioned, I have a provider who is facial plastics certified and head and neck certified. So he does do a lot of cosmetic surgeries as far as brow lifts, eyebrows, forehead lifts, face lifts. So it just depends on what location you go to and what providers are there to provide that service. Can you ENT techs go overseas? If not, why? I'm not sure if I have the best answer for this. You guys might want to add something in, but I believe that as far as new ENT techs who have just gone through the school, I believe they can go overseas. Most students that are in the course come from overseas anyways, and they do the course and they tend to go back to the location. As far as having the skill to be overseas, from what I've heard, as far as ENT, the cases tend to be a little bit less extensive as on the state side. Typically, it's more of your routine ear, nose, and throat cases. I'm not sure if you guys know anything.
Well, I think you mentioned it earlier about as far as we do go overseas. If that was the portion, I'm not sure if it's you are referring about deployment as well. Because as far as overseas, we are limited to certain bases. You said 4, right?
Yes.
Some Europe, 1 in Japan.
So we have one, yep, in Landstuhl, Germany, Lakenheath, England. We have Alaska, and we have Yokota.
So, but if the question was, I wasn't sure, maybe you were referring to as far as deployments. We do deploy as well, but I think right now, I think we deploy as a SLIC most of the times now. Before, I know we've deployed and we serve as an ENT tech, and we're assigned to an ENT doc while we're deployed. But I don't know how it is now.
I can add to that too. Myself and Lieutenant Amazon was stationed together in Japan, and while stationed in Japan, I had an opportunity to deploy out of Japan, not as an ENT tech, as a 4L, but it was kind of a unique situation, and I absolutely took advantage of that. As far as surgeries overseas, we're lucky to have a provider that was concentrating in his plastic side of the house. So we did a little bit more unique procedures over there, but I can tell you predominantly in an overseas setting, it'll be minimal basic cases, a lot of tonsils and tubes and so on. So to send either a pipeline or a SLIC that's new to the career field to an overseas location probably would not be detrimental to their skill levels as far as when they come back to stateside, how much they would be able to support the clinics. So from that perspective, I think keeping them stateside would be the best way to go.
And just in addition, as far as going back to the plastics. Typically, if you go to a larger facility, so, and most of the time, like those doctors there, you'll have one that's specialized or did a fellowship in those specialties. So Lackland, SAMC, those are bigger ENT where they do a whole lot. Pretty much they do everything. So in bigger facilities, they're more likely to be doing bigger cases compared to the smaller facilities, like overseas.
So the next question is, do ENT techs find it challenging to get OR time away from them? So I know as far as my dates, we currently only have 2 ENT providers, ENT techs. Master Sergeant Mickens is an ENT tech, but she is tasked to provide coverage for the OR as far as flight chief duties. So me and one other person are handling the clinic, and it is a little difficult to get time away from the clinic because, you know, we still have to provide support for the clinic, and we try to keep our skill level up by providing support for the OR. I know as far as trying to get augmentees to help in the clinic, I know it's a communication thing with the ORs trying to provide support. But I think it just depends on the location that you're at. Some places you have a decent amount of staff. In other places you are shorthanded. But as far as trying to find time to get away from the clinic, it's just more of a communication thing. I think once you get other people involved and you kind of get a game plan as far as how you want to volunteer for outside activities, or you know, if you're tasked with other duties in your clinic and everything, it's just trying to talk with everybody and come up with a game plan. Do you guys have anything on that? So what do you do when you are short-staffed in the clinic? Do you not go to the OR or do slicks on the clinic? Yeah, sorry. So the question is, what do you do when you are short-staffed in the clinic? Do you not go to the OR or do the slicks augment the clinic? So that kind of ties into the other question. Obviously, we're short-staffed here. So right now, with the current pandemic that's going on, the opportunity to provide support for the OR is a little bit more difficult because we are trying to get back to a capacity in the clinic where we can fully support the clinic. I know that we are trying to work out a way that we can divvy up the work to where we can have at least one member going up to the OR and one member in the clinic. But as most people know, you know, everybody has additional duties, and so that kind of always tends to get in the way of the clinic side of it. And you guys feel free to jump in whenever you want. So would any of you have changed your decision to shred? If so, why?
I'll help you with that. No, I actually love ENT. I think the one thing that Sergeant Dominguez mentioned is about the rapport with our providers. I've yet to been to or stationed at a place where the team is not cohesive, and most of the ENT, majority of them are laid back and easygoing. So that makes it a lot easier and simple to learn your job and be proficient at it. Is team dynamics. It goes a long way. So I've, like everybody else here, I think I went through the NCORP, in 08. So a long time ago. At that point, I didn't want to leave the OR because I enjoyed working up there with all the different specialties. But after finishing it up and going through school and actually working in the clinic, I really enjoyed it. And now I'm back in the career field and now I'm out again. So as far as being an ENT tech, but I'm always here to support Sergeant Dominguez and help out my team any way I can.
Well, for me, I have to be honest. I miss ENT, so it's a really great career field. I know Sergeant Nahara, I do. Obviously, you get the good thing about ENT or any other clinic job. You get both worlds. You have the OR and then you have the clinic side. So it really is a big help for a lot of folks who are sometimes drowned in the OR, just the workload and stuff. But being a shred, you do get both worlds. So you can have your OR time and then your clinic time. Yeah, so I shredded same in core program back in 09, and I volunteered actually because I was number 3 on the list, so I had to. But I chose ENT. It's because I've always seen it just like what his experience. ENT is always more laid back. And ever since I've enjoyed it. I did have a good startup at Lackland, so I did experience everything. Like what Sergeant Dominguez was saying earlier, ENT is not just boogers and snots. And I came to find out at Lackland too that it's such a vast specialty. You get to do everything. And it's very highly specialized in a lot of different things, but experience-wise, it really forms you too. You do grow as a person, as an NCO. I did learn a lot being an ENT because when you go overseas, there's just we were just talking about this earlier. It might just be 1 or 2 of you, and you're managing the clinic, and it's not just the clinic that you'll have to worry about. You'll have to worry about all the Air Force additional duties that you'll have to handle. So with that, you do learn and grow. And I think that was one of the biggest things that I've taken from that, and it prepares you as you go up in rank, and to your next base, you'll be more experienced. But yeah, no regrets shredding to ENT.
Yeah, definitely out of the 3 shreds, I definitely know that I made a good choice. Like I said, I like the kind of surgeries we do. I like the providers I work with. When I was in my ENT school over there at Lackland and in SAMC, I had a really great time with all the providers there and got to see a whole bunch of different cases. Something we don't do here is inner ear cases, and those are like the most exciting thing to see because you're dealing with the tiniest bones inside the ear, and it's definitely a good experience. Yeah, I definitely love my job. I almost don't want to rank up because I don't want to stop doing my job. I prefer just to be in the OR, be with my docs, and have a good time. Okay, so the next question is, I've been away from the med group a few years. Has there been any challenges or big changes since DHA has taken over? So, I mean, I was told if I never have nothing nice to say, not to say it at all. So.
All right, I think that question was just posted just for me. All right, so I got DSD in 2015 to be a military training instructor. So I've been out of the career field for almost 4 years. And coming back into the career field with DHA and all that, that's kind of like a foreign language to me. Everything has changed. So it's been difficult trying to transition back into the clinical side or medical side of the world. But again, I lean on the people that are here. Sergeant Dominguez has been awesome trying to, help me navigate through what the clinic life is like in the OR side. But yeah, it's difficult coming back. I would advise if you do go out. First, I want to say that I am living proof that you can go do a DSD tour, even in a shred, right? So don't be discouraged. It can happen. But just keep in tune with your career field. It's important. I kind of got pigeonholed into what I was doing. In the latter part of my DSD, I started to reach out to get into what was going on in medical side, but it was such a big difference that when I got back here, I did have to have needed some guidance as to how to navigate things now. So.
Next one is it hard to jump back into all surgeries when you deploy the SLIC or have to go on a non-ENT mission? So no, I mean, as far as my own experiences, I actually got tasked to go on a humanitarian mission as a SLIC, where I had to do GYN and orthopedics, and I had already been out of the OR for about 2 years. But since you're already kind of keeping up with your skills, it's kind of like riding a bike. You never really forget how to do certain things. So it was definitely a fun experience to go back and do cases that I haven't done in a while. And everybody has a different experience when they go overseas. Everybody tends to get along so much better because it's just a tight-knit group that you go with. And so I don't think it's hard to jump back in. I know there's certain things that certain providers like, but it's kind of like the basics, as long as you know the basics, you can kind of defend yourself the rest of the way. I've never really deployed before, so I don't have experience with that. I don't believe either of you two. So it was a different, But as far as my own personal experience, I don't believe it's that difficult to remember some of the stuff you did prior to shredding out. Does anybody have any other questions? Going once, going twice. So I just want to take this moment to thank Sergeant Mickens and Lieutenant Amazon for coming out here. I know they didn't talk a whole lot, but that's fine. But I kind of wanted just to show that, even if you shred, it's still possible to end up having a DSD or end up becoming an officer, making rank. Clearly, we've all made rank. So it's more to understand that, it's not impossible to achieve whatever dream you have in the military, even as a shred. And then I also want to thank the instructor over at San Antonio, Tech Sergeant Arbach, because she provided me a whole lot of information that I was not aware about, and Master Sergeant Roque over at the Academy for giving me some great information as well. I just want to thank everybody for having to bear these 35 minutes of my stiff talking. But yeah, thank you guys. Honestly, it's not this dry being an ENT. It's a lot of fun. And thank you guys for listening.
It's the best trend.
Absolutely.
Oh, wow. Okay. All right. Well, thank you guys again for this opportunity of sharing your perspective on your shred. We definitely appreciate your feedback and answering questions about, that some folks may have about wanting to shred into ENT and the other two specialties that we had this week. I just want to kind of clarify and make sure that people are aware some things. So the question was brought up. There's always that retraining window, right? That we always talk about. Hey, you got to be within your retraining window to shred. But there is an exemption to policy. If you have an airman, A1C, or senior airman that is not in their window and is really, really wanting to shred, you could utilize that policy letter to get them to get into a shred class. So that should be out there for you guys. I'm actually in the process of updating it. There really isn't going to be much change to it, but that just gives you kind of like, hey, I really do have an eager airman that really wants to go into this specialty, and we really need folks in ortho and ENT. So please, if you do have anybody out there, reach out to your leadership and let them know that Sergeant Nahar mentioned the exemption to policy, because I really do want to go into one of those specialties. The other question that was kind of asked, I asked regarding new shreds. I don't know if there's anything written, but I would hate to have somebody brand new coming into into that specialty go overseas, and we all know overseas can be a challenge because you may not get the quantity and the diverse cases that you potentially can get in a stateside assignment. So I would discourage for somebody, unless we become so desperate to the point where we have to send folks to fill the overseas assignments. I would probably have some concerns about that, because things happen overseas and you can't just make things happen to support the clinics, because you pretty much would be utilizing normal slicks to kind of help fill, and they don't have that skill set either. So the ideal situation is for members to graduate from their school, get to their station, whether they come back to the same base they're at, get their upgrade training to a 5 level, and now that opens up doors to go overseas. And the other thing was regarding deployments, right? There's very few unit type codes where you actually have specialty techs where they can actually deploy as that specialty. There's very few of them out there, so there are those opportunities. I encourage you to ask your leadership to say, hey, do we even have that UTC to potentially deploy somebody, a ortho, ENT, or urology tech. Now the ground surgical team, that's the very hot topic when it comes to deployments. I try not to utilize shreds. I use them as a last resort, so that for some reason things kind of happen and we don't have any slicks that can support the ground surgical team. So I try not to utilize any of the shreds, because of the fact that, that's now impacting the clinic, that's impacting surgeries. So that's why we try to stay away. I mean, we have deployed shreds before, and I'm not saying that you can't, but we just got to make sure that we make smarter decisions to making sure what impact will it have for pulling an ENT or ortho or urology tech to deploy as a ground surgical team, which technically is intended to be a slick. The other thing that I think I mentioned yesterday too, if you have an airman that really is eager to wanting to know what it's like to be in the clinic, please, I encourage you guys to reach out to your leadership and really express your interest in wanting to see what it's like. You can shadow them in the clinic for a few days to a few weeks if the OR can support that. I highly encourage you to do that, so that you're able to understand like what is clinic life like, because we all know as licks, we know what the OR is like. We get to interact with the shreds when they come up with their docs and operate. So the clinic perspective is something that you probably need some exposure to, and I encourage y'all to do that. And it's very important. I really like the diversity that the shreds have, because like Sergeant Dominguez mentioned in some of the other shreds, you get to work, you see that patient come in with that injury, physical therapy is not working, you can't get that patient, to get better in a clinical aspect. So now we have to get to that point where we have to help you heal or fix what's broken, and we have to go into the operating room. So you get to see that patient come in with their pain, with their issues, what doesn't work in the clinical aspect, and now we have to go to where we have to operate on you. And you get to see, not only work with the doc, see how you fix them, but also get to see them afterwards. They're recovering, because that's the most important. You can go in there and fix somebody's, nose, but if they're not doing the things that they need to, they could come back with that same, injury or deformity. So that's important. And we as SLICs don't get to see that. Like you had mentioned, Sergeant Dominguez, we're used to is we see that patient get rolled back, and we're sometimes able to identify that the surgery or the deformity that they may have, where there's a broken bone, a huge deviated septum where they're having trouble breathing, or they have something, a GI, or should I say a GU concern that you never get to see what brought this patient into the operating room. And just to give you some numbers, right? The health of our shreds, since this is the last series for the specialties. Right now, the two shreds that we need people to shred into is orthopedics. Right now, orthopedics is at 73% manning across the Air Force. The ENT is at 68%. So we definitely need you guys to consider going into one of those shreds, because I know there was we have some of members that don't want to volunteer. They get comfortable in their little bubble and don't want to shred. They're afraid of doing something different. And I encourage you guys to do that. Get outside of your comfort zone. I thought about it early in my career, and I just never, decided to do it because I don't know. I just didn't want to go through tech school over again. At that time, I had a very young children, and it would have just been challenging for my family to go to school and go through that process again. But again, it's what's important to you, because at some point those opportunities maybe you're kind of forcing the Air Force to tell you, hey, we really need people, and that's usually what causes the NCO retraining program to select members that are eligible, SLICs that are eligible to go into some of those specialties to help our numbers go up. Right now, urology is actually at 100%. So if you're really considering into urology, please consider ENT or orthopedics so that we can get the health much better, so that we're able to do the things that we need to and support those specialties. And then last thing that I want to share with you guys, and something that I'll talk with y'all during my session of professional development. This is a way for you to kind of diverse your skill set. Being able to scrub and be good at it, great. What else can you do? So this is another way for you to do something a little bit different, challenge yourself, and be the best ENT tech or the best orthopedic tech, and be able to truly see the impact that you have in the clinic as well as in surgery and afterwards. And to me, that's pretty amazing when I get the opportunity to talk some of the shreds, and they express how cool it is to see that change within taking care of our patients, not only active duty, dependents, retirees, and if you're at a joint base, get to work with some of the different services, even the VA here at Nellis Air Force Base. So again, please take advantage of these sessions to educate yourself and also others who may be considering going into one of these specialties. Again, thank you for your time. Hope this helps you guys. I know that all it needs to do is educate one person, so that we can at least start sharing the word of getting folks to really know what else is out there than just being your typical OR tech working at base X, Y, and Z. So again, thank you for your time. Thanks, guys, from Keiser and that lieutenant sitting back, enjoying life. We appreciate you, sir. Get your tail back to Nellis. Sergeant Kaloides, thank you for getting everything coordinated. And New CFM, I'm out.
Thank you, Sergeant Ahar. So that's going to wrap up this week for the shred videos. Our next session is going to be on the 22nd of July. We're still keeping it at 5 Central, so it just makes it easy for everybody. And that's going to be sauced. So if you're interested in learning about that, please join in, and y'all have a great night.